All right, so we've got a young horse here that presented for swelling on the face. Like we've said in multiple videos, if there's swelling on the face, especially in this region right here on the maxilla or on the mandible, until proven otherwise, it's a tooth. The jaw sometimes on young horse or even other horses, you can have a fracture. So you have to be careful with that and make sure you get it assessed with x-rays. On top, it could also be trauma, but until proven otherwise, it's typically a tooth. So this was a young mare here, a draft horse that had acute swelling on the other side over here. And then she also had a problem on a lower 9, so we've got a CT scan of her that showed not just this tooth that we took out today, but the one that we're going to take out in a couple weeks. Sometimes it's really nice to have that three-dimensional shape. We use CT scans to get a better diagnosis, but also often for surgical planning and to determine the best approach and how to basically set up for the most successful technique possible. So we'll show you here where that swelling was. So it's a little bit hard to appreciate on the video, but this area right here was swollen. And the history was that it got swollen really quickly, and then the swelling went away after a few days. And that's not atypical, because what happens with any tooth abscess, just like any abscess in the body, is there's an initial period where there's the infection that starts to spread. And as that spreads, it forms pus and dead white blood cells and bacteria, and that has to go somewhere outside the body. And so it'll always look for the path of least resistance. In this case, the path of least resistance, what happened is it started draining into the mouth. And then the horse is swallowing the pus, and that's why it went down. That's why so often dental disease is misdiagnosed, because the signs can kind of go away a little bit as the infection is draining into the mouth. So if you have a horse that has a broken tooth or a bad tooth, and you think the horse is doing fine, make sure you get it evaluated by somebody that really does a lot of dentistry and has a lot of experience, because it can be deceptive. There can be something severe going on, but it just doesn't show a lot because that pus is being discharged into the mouth. So what we did in this case is we did the extraction of the bad tooth, and we can see right here, this is where there was a draining tract. So what happened is the abscess formed right around here. This is where the root is. The pus built up, and then the pressure little by little eroded a channel, and then the pus ended up coming out into the mouth. And so because she's a draft, we can see how big this tooth is. This tooth is about at the widest spot here. We'll see, we'll measure it the right way. So we have pretty much 3 inches. So for you guys in metric, that's about 9 centimeters long by 5 centimeters wide, or 2 inches wide. So it's a massive tooth. They can be very difficult to extract because of their size. And like I said, we have one more tooth on her that we're going to have to take out. Yeah, but what we want to do is, because it's on an opposite side on the bottom, so at a diagonal, we want to let this side heal, make sure she's doing well there. We'll give it a few weeks, and then we'll go ahead and do the other side. So this is just an example again of what we would call anachoresis, or blood-borne infection of a tooth root, and once that happens, the only solution is extraction. Fortunately, these horses do really well, and she'll have a great quality of life without this tooth.